Welcome back to AM Northwest. If you have balance issues, our next guest is here to shed light on a possible cause. We welcome Executive Director of the Vestibular Disorders Association, or VEDA, Cynthia Ryan. Good to have you with us.
Thanks for having me.
First of all, what is the vestibular system?
So the vestibular system is a small system in your inner ear. It controls your balance. When you have a vestibular disorder, when there's something wrong with that system, either due to illness like a virus or injury like a concussion.
Right.
You can have problems with your balance. You might experience dizziness, vertigo, which is the sensation that you're spinning or the world is spinning around you.
Oh, that would be awful.
It's very disabling. Other symptoms include hearing loss, tinnitus, which is a constant ringing in the ears, which is also much more debilitating than you might think. It also causes constant fatigue because when your brain is trying to keep you balanced, it doesn't have as much energy for other things like cognitive functioning.
Right. Yeah.
So you'll have memory loss, you have problems concentrating, you can have sensitivity to light, all sorts of things, but because these symptoms are invisible to others, it's, people feel very isolated because no one understands what you're going through.
Right.
They're also very difficult to diagnose. So most of the time you're dizzy, you go to your primary care physician, right? And what their primary focus is in ruling out the life-threatening conditions like stroke. So, they'll maybe give you an MRI. Once they rule out those life-threatening conditions, most often patients are sent home with medication to cover up the symptoms.
Right.
And told it'll either get better on its own or you just have to learn to live with it, and that's just not the case.
Who's affected by this mostly?
Well, actually anyone can be affected.
Any age?
Any age. We have many pediatric patients who suffer from vestibular disorders, people in their 20s, 30s, 40s. It is more common as you age because when you age, the vestibular system, it basically gets worn down just like many of your other systems.
Right.
So older people do have more problems with balance, but anyone can have it. The statistics are that 35% of people over 40 in the United States will have some sort of vestibular dysfunction in their life. So it's more common than you think. People just don't know that this is what's going on for them, and their doctors don't know. Their doctors, they probably cover vestibular disorders for 30 minutes in all of medical school. So unless you're seeing a specialist, not just even an ear, nose, and throat doctor or a neurologist, but someone who specializes in vestibular disorders, you're very unlikely to get an accurate diagnosis. And without an accurate diagnosis, you're not going to get effective treatment.
What causes it?
There are many different causes, and there are many different types of vestibular disorders. It's not like there's one type. There are many different types. They can be affecting the inner ear, the nerve leading from the inner ear to the brain. So, and that's one of the things that we do, is we help people learn about what's going on with them so that the patient can be a better advocate for their own health. Because you go to your doctor and sometimes you just don't know what questions to ask.
Right.
So if you learn about the different types of vestibular disorders, then you can have a better conversation with your doctor. We have so many people that tell us that, I had this problem, I went to your website, and I'm like, oh my God, that's what's going on for me.
Right.
They felt so alone and misunderstood, and they feel like, oh my God, I'm not alone.
Which is super important to have that.
It is.
And then there's a Balance Awareness Week going on.
That's right. This week is Balance Awareness Week, and it's a grassroots effort to raise awareness about vestibular disorders so that we can, reach those people who are suffering alone and don't know what's going on for them, help them learn what's going on for them, get them connected to vestibular specialists so they can get an accurate diagnosis. Just when we were waiting to come on, I was talking to some people, and one woman said, oh my God, my brother has this.
Oh.
And he was told that he just has to learn to live with it, and that's just not the case. So we want to get people help. We want to get them connected to specialists.
Are there cures for some types? Or?
Well, there are treatments for some types. There's no cure.
All right.
Usually, you just have to learn. There are treatments like physical therapy. Also, lifestyle changes like a low-salt diet helps some type of vestibular disorders that have to do with the fluid in the inner ear.
Right.
But it's just a matter of figuring out what the problem is so that you can get those treatments. But they are often chronic, and you do have to live with these symptoms and learn how to cope with them.
We want to tell folks, if you'd like to find out more about VEDA, Balance and Balance Awareness Week, which is September 18th through the 24th, just give them a call, 800-837-8428. We'll put that information for you on our website at KATU.com. Cynthia, thank you very much. Appreciate it.
Thank you.